Hello, everyone. It's Olga Fleming, CEO of Good Fuse, and on today's New Abnormal, I'm talking with our colleague Abi Obre, who's a VP in our practice, recently joined. And today we're going to be talking about health literacy. And wow, what an amazing subject matter to be talking about at this time when so many of us, given the pandemic, have had to really upskill ourselves on everything from viruses to vaccines to even the clinical development process. So really excited to be talking with you, Abi, today on this very important subject matter.
Thank you. It's great to be here, Olga. Appreciate it. I'm actually very passionate about this topic in particular because to me, I mean, it's really very much about the emotional aspect of healthcare and of the healthcare journey. And that's because of what my family went through when my son, who's now 4, was diagnosed with a rare condition that required significant surgical intervention at just 3 months old.
Wow.
And yeah, and I couldn't even pronounce the name of the condition at first, let alone understand it or make decisions on what surgical approach we should take. It was really an intense medical experience, the most intense I've ever encountered. So, I'll never forget the feeling of complete helplessness, of having to kind of surrender yourself to a system that speaks an entirely different language, and having to learn all of these new terms and feeling completely lost at sea. So I knew there was a better way, and I felt like there perhaps were ways of putting the information together that would help me feel informed and help me make the best choices for my son.
No, I think you bring up a very good point with it, which is empathy and health literacy. As communicators in healthcare, one of the things that we try to do is make sure that we are presenting things in a way that is informative, digestible, um, educational. And sometimes, we forget about the empathy part of this equation. I can tell you from my experience, our agency had the opportunity to do ethnography in the area of breast cancer. And what we saw was that, patients are so overwhelmed by the cancer diagnosis that sometimes when they're speaking with their doctor and their doctor is giving them very important information, they don't necessarily come out of that, appointment with a full understanding of what they said, because in their mind they're thinking, how am I going to tell my husband or my loved one, or how am I going to tell the kids, or am I going to die? And it's a very interesting component to health literacy, is to really understand the mindset and the state of mind that people are in when they are consuming healthcare information, because I think as communicators we could do a better job of how we serve it up. So I know that you've worked in health literacy for a long time as a communicator for a very large hospital network prior to joining us. Tell us some of the tips or some of the things that you would recommend to communicators and others as we're trying to make healthcare information not only more accessible, but also more useful.
Yeah, so it's a big problem, but the good thing is, as you said, Olga, there are things that we as healthcare communicators, can do about it. We have a role in this issue. So, the most important thing being lead with empathy, patient first, always. That is needs to be top of mind. Listen, as you said, listen to how patients are receiving the information, because you really don't know what state of mind people are in when they're embracing this information or being presented with a diagnosis. And at that moment, all great emotion, they're being thrown a lot of information that probably they don't really understand. So another thing we should encourage patients to do is to bring someone to take notes on their behalf, because a lot of it will not be heard. We can also remind our medical spokespeople not to default to jargon, which is where providers really feel most comfortable. you know, making them really understand that it's really not the journalist or interviewer who they're speaking to, but the people at the other end who are going through perhaps a healthcare crisis. We can also reorganize information, put the most important points first, maybe tailor communications to the specific point of the patient's journey or treatment timeline. Editing down, thinking carefully about choice of words. And then also there's certainly a very important aspect is accounting for culture, being aware that some diseases are perhaps still stigmatized in certain populations. And then accessibility, incorporate translation services. Don't assume that patients have Wi-Fi access to be able to go and Google what you've shared with them after that appointment. So making no assumptions about understanding and focusing on reaching those underserved communities.
Wow, those are really great tips, especially the cultural component. So often we think, well, health literacy is easy. We'll make it, we'll put it in lay terms, we'll provide it through a variety of channels. But we also really need to understand how all communities and different communities will consume that information, and how we need to be helpful in providing the right information at the right time to the right audience. So this has been great. Thank you so much, Abby. I'm feeling that you're probably going to be authoring some thought leadership piece specifically on health literacy to give people, some of these tips so that they can, create programming that really makes a difference. So thanks for that, Abby. It's going to be a very important component, especially in this new world post-pandemic.
Thank
Thanks,
you.
everyone. Join soon.